I've heard that HRT is a risk factor for heart disease and stroke. Is that true?
HRT has been implicated in heart disease and stroke, and several years ago in the early 2000s there was a large study called the Women's Health Initiative that involved thousands of women who are on a hormone combination of equine estrogen or horse-derived estrogen plus a synthetic progestin. And these women had an increased incidence of breast cancer, heart attack, stroke, and blood clots. Although they had an increased incidence, their incidence was small, but it was real. So every patient who is considering hormone replacement therapy needs to have a discussion with their physician about their own personal risk for these disease processes and decide if hormone replacement therapy is right for them.
Does the use of HRT increase my risk for breast cancer or other forms of cancer?
Again, that study that was done in the early 2000s, the Women's Health Initiative, did indicate that. Breast cancer did increase with the use of estrogen replacement therapy, and it is important that those patients who are at great risk or increased risk for breast cancer be aware of that, and all patients understand that there may be a slight increased risk of breast cancer with the use of hormone replacement.
Are there any women that shouldn't take HRT?
There are women that may not be candidates for HRT. Those with a personal history or a strong family history of breast cancer, those who have a personal history of stroke or heart attack, and maybe those who have had a blood clot or may have a clotting disorder, just to name a few. All of these things need to be considered when a patient is determining whether or not to use hormone replacement therapy.
Can you only use HRT for a certain amount of time?
Whether or not how long a patient can use HRT is an excellent question. And the recommendation is that you typically use the lowest dose for the shortest amount of time. But this needs to be an individual decision made between the patient and her physician. Oftentimes, patients will continue to have menopausal symptoms for years after going through menopause. And those patients may benefit from a quality of life aspect from hormone replacement therapy. And after discussion with their physician, identifying the risk and understanding the risk, they may elect to continue that therapy.
We hope you have found this information beneficial and will join us again for another medical moment. For more health-related information or for services available at the University of Tennessee Medical Center, visit our website at utmedicalcenter.org or call the Healthcare Coordination Office at 865-305-6970.